and welcome to American Society of Clinical Oncology 2016 meeting here in Chicago. We are about to review highlights of a multiple myeloma part of the meeting, and we're going to start with a review of a study called CASTOR, which is a study of a medication called daratumumab, which is novel human anti-CD38 monoclonal antibody, which is being tested in the phase 3 study, where patients with relapsed or refractory multiple myeloma who received more than one or equal to one prior regimen, including bortezomib, but not refractory to bortezomib, are randomized to receive the antibody on top of bortezomib and dexamethasone. This study now has a follow-up about 7 months, and the study results showed high activity of additional antibody to this regimen, where particularly of importance, progression-free survival almost doubled from about 27% to 60%, and other findings related to activity of the medications are also noted. The p-values for time to progression, overall response rate, and other findings of CR and PR are all highly in favor of using this medication in the patient population at hand. So because of that activity, we may envision that we are developing here, and we are witnessing development of a new standard of care for patients with relapsed refractory multiple myeloma receiving bortezomib and dexamethasone alone. The medication was otherwise safety, as the safety profile was similar to what antibodies usually with transfusion side effects usually have. The next one is the Keynote, another study where patients with multiple myeloma were exposed to novel agents. We know that immunomodulatory inhibitory drugs have a dual mechanism of action that are tumoricidal and immunomodulatory, and adding anti-PD-1 antibody to it may, in fact, improve the overall results. So the Keynote 023 study was a phase 1 dose escalation and expansion study of pembrolizumab and lenalidomide with low-dose dexamethasone in patients with refractory or relapsed multiple myeloma. Overall response rate was for efficacy population about 50%. Majority of these patients had a partial response. There were some patients with complete response, and overall what we call disease control rate was achieved in majority of the patients in efficacy population, even in those with lenalidomide refractory population that were allowed to participate in the study. The profile in terms of side effects was those consistent with the side effects seen in the past with these medications. These medications are very well known to us, but a robust activity in these heavily pretreated patients with refractory multiple myeloma suggests that continued development of PD-1 antibody pembrolizumab in multiple myeloma is needed. Lastly, one study that is important for practice right now is a study that looked at upfront autologous stem cell transplant in newly diagnosed multiple myeloma, where patients in this prospective randomized study were randomized to autologous transplant versus bortezomib, melphalan, prednisone for newly diagnosed patients with multiple myeloma. Comparisons were done in multiple levels, but overall the results suggested that upfront autologous stem cell transplant significantly prolongs progression-free survival versus the standard therapy for patients with newly diagnosed multiple myeloma. This needs to be taken seriously in our everyday management of the patients with multiple myeloma, because despite the era of novel agents that are being developed, upfront transplant appears to still be a standard of care for younger, fit patients with newly diagnosed multiple myeloma. With that, I'll conclude the part on multiple myeloma. I'll thank you very much until next year here in Chicago at ASCO 2016.